So welcome back. Now today we'll be talking about depression after stroke. But first, let's review why it is important. Now, if you look back in history, how depression was viewed in history is very different from how it is viewed today. In the ancient civilizations like 3000 BC, the Egyptians, etc., mental illness was very different or very separate from the physical body. A demon or a spirit had invaded the physical body and was causing problems. The ancient Chinese, around 2000 BC, believed that there was a mental problem in patients that would then cause a physical problem in the body, but they weren't clearly linked. It wasn't until our friend Hippocrates in about 400 BC that treated psychiatric illness as a physical disease, meaning that just like all other physical diseases, it had a scientific reasoning or a natural cause behind it. Then the Persian physician al-Balkhi in 870 AD did a lot of work in depression, and he realized that psychotherapy really helped these patients. And finally, the father of modern psychiatry, Dr. Philippe Pinel, in the early 1800s, really changed how we view patients with psychiatric disease, in that they do not have full control over their disease and they should be treated with respect and dignity and humanity. Now, today we know that depression and mental health illness in general can be a very destructive as far as recovery from major medical issues and major medical events, such as heart attacks or strokes or cancers, because not only does it affect the quality of life, it actually affects the survival rate of the patient after these events. Now, I'm going to date myself a little bit here, but in the mid 1990s, when I was just a lowly medical student, I was part of a team that was taking care of heart patients in the hospital. And the head physician, the one all the way at the top, the most experienced, was in charge of the whole team. The cardiology attending, his wife was a psychiatrist, and he was very passionate about the effects of depression in patients after heart attacks, because in the 1990s, there were a lot of studies that were coming out showing that after a heart attack, there were some patients that did great, but then there were other patients that didn't seem to do so well, and they were dying sooner than expected. And it turns out those patients had untreated depression. And once you treated their depression, their numbers improved quite a bit. And now we know that depression in stroke is not universal, meaning that for every 100 patients that have strokes, about 30 of them will have depression, so not everybody has it. However, we do know that it does affect recovery, and it does make the recovery harder from the stroke, and it does decrease the survival after a stroke, and that effect is sustained, meaning that it's a fancy way of saying that even 10 years later, if a patient who has had a stroke is struggling with depression, it will affect their quality of life and it will affect their chances of survival. Now, I was very lucky because I went to a rehab hospital that was very aggressive. They were very on top of things. And that first week after my stroke, I had a lot of complications. And so they screened me for depression. They started treatment right away. And being a doctor, I did not hesitate to take treatment for this at all because I knew it would increase my chances of survival and it would hasten my recovery and it would hopefully help me live longer. As the physician al-Balkhi would say, the greatest medicine is knowledge. Until next time.